If you are watching this video to look for answers, you might be at your breaking point. You are caring for a loved one with dementia, and they aren't just forgetting names anymore. Maybe they are shouting at you. Maybe they are refusing to shower. Maybe they are waking up at 3 a.m. trying to leave the house. And in your quiet moments, you might think and wonder, are they doing this to spite me? Am I failing them? I'm Dr. Lim, I'm a geriatrician, and I want to tell you two things immediately. Number one, you are not alone. And number two, this is not bad behavior. It is a medical symptom, and we call it BPSD. BPSD stands for Behavioral and Psychological Symptoms of Dementia. In the early stages, dementia takes the memory, but as it progresses, it changes how the brain perceives the world. And when a person can no longer understand the world or communicate their needs, they express their distress through action. And we group this reaction into two categories. The first category would be behaviors, and these are actions like aggression, wandering, restlessness, and hoarding items. The second category would be psychological. These are the feelings, anxiety, hallucinations, and delusions. The biggest mistake we make is treating these like disciplinary problems. We try to correct them, but in geriatrics, we view BPSDs as an unmet need that the patient cannot speak about. Let me give a common example. Imagine a patient has a full bladder. It hurts, but the brain has lost the connection that says full bladder equals to go to the toilet. They just feel the discomfort and panic. So they try to climb out of the bed. The nurse tries to stop them and prevent a fall. The patient hits the nurse. We see aggression. The patient feels, I am in discomfort and you're trapping me. If we give them a sedative, we silence the behavior, but we leave them in discomfort. So if we take them to the toilet, the aggression disappears. So how do you figure out the need? We use the ABC model, and I want you to become a detective. A is for antecedent. Basically, what happened before the storm? Was the room noisy? Were they hungry? Was the lighting poor? B is for behavior. What exactly did they do? And C is consequences. How did we react? Did we shout back? Did we make them more scared? By looking at the antecedent, we can often solve the behavior. Let's look again at the toilet example using this ABC tool. Most people will only focus on B, which is the behavior. So the patient hits the nurse. So they treat the hitting. But if you look at the A, which is the antecedent, you find the full bladder. And if you change A, that is to take them to the toilet, then B, which is the hitting, disappears on its own. By understanding this dynamic, you potentially avoid unwanted consequences like more aggression or even the use of strong medication or sedatives. I know this sounds simple in a video, but it is incredibly hard in real life. You are tired, you're human. This is just the introduction. I'm going to produce a series of videos tackling specific behaviors. Wandering, aggression, sundowning, using this framework. For now, remember, behavior is communication. They aren't giving you a hard time. They are having a hard time. So if you have any specific behavior that you're struggling with, leave it in the comment section below so I know what to cover next. And take care.